So, hello everyone. So, yesterday we talked about ulcer in mouth. So, it is basically also known as stomatitis. Okay. Today we will talk an important topic that is dysphagia. Okay, dysphagia, very important topic. Dysphagia. Okay. What is dysphagia? Dysphagia is nothing but difficulty in swallowing. Difficulty or difficult in swallowing. Okay. So the term dysphagia is a medical term which describe there is a problem in the uh, okay, in the swallowing. Okay. So there are multiple reasons you have to check anatomically because if there is any structural changes, then only the patient have difficulty in swallowing. Okay. Here we have mouth. Is there the problem in the mouth? Is there any problem in the throat? Or is there any problem in the esophagus? These are three areas we have to examine. So physical examination is must and compulsory. So you have to take one torchlight, very give intense light. Okay. You have to open the mouth of the patient. You have to take tongue depressor. If you want torchlight for examination, you need for examination. Okay, okay, you need one torchlight. Okay, and tongue depressor, which you have to depress the tongue and you have to check the all the tonsillitis, esophagus, epiglottis, laryngeal. Okay, all these things, larynx, pharynx, everything you have to check. Okay, sometimes you need to do laryngo uh, examination. Okay, sometimes you need uh, endoscopy. Okay, so you check the proper anatomical structure of throat. Okay, so basically they have three types of possibilities of having patient dysphagia. One is any disease of mouth, throat, or esophagus. What are the possibilities? One number is mouth or throat, and we have esophagus. Esophagus possibilities having any issues in the mouth or throat or esophagus. Next, we have any nerve nerve disturbance. Okay. Nerve disturbance because we need the nerves for swallowing. Any type of function of muscles need nerve signals to do. So, is there any possibilities of paralysis, bulbar paralysis, or any neuritic neuritis, or we have 11th cranial nerve, which is coming from the brain. So, having possibilities of paralysis of 11th nerve, or in the myasthenia gravis, it is a disorder of nerves in which the patient having difficulty in swallowing. In myasthenia gravis also, okay, or other possibilities we have thyroiditis, enlargement of thyroid, okay, or pericardial effusion, or bronchial neoplasma. These are the possibilities of uh, this dysphagia. Okay, so first is any issues in this local region or nerve disturbance or any possibilities of local organs which are present in the throat. And next, I thought we were esophagus lesions, okay, or esophagitis, ulcer in the esophagus, or stenosis, the passage of food, the passage of food area is decreased in the esophagus. That is the common reason. And you have tumor, malignancy, okay, or carcinoma of throat or esophagus or mouth, okay, which are responsible for dysphagia. So you have to possible. These are the possibilities. You cannot assume one thing in dysphagia. So you have to go through the history, examination, sometimes blood sample, sometimes scanning. All this will allow you to do proper diagnosis. Primary. Secondly, sometimes happen. Little mild things will have happen, which causes disturbance, swallowing. Okay, sometimes they are moderate problems, sometimes are severe problems. So best you have to diagnosis and see the local and area local examination and all this history will tell you about which problem is there. Okay. And I told you you can do the examination. Okay. You have to check you have to keep your hand at the throat region and ask the patient, is there any pain in the local area? Okay. Okay. So you will observe. So here one examination you can do that is laryngoscopy. What you can do? Laryngoscopy. Laryngoscopy. Okay. And it will tell you the little lesion or new plasma disturbance. It will tell you. And another is the most common test is observed, that is barium swallow. Barium, okay, it is a after swallowing, the patient can begin to do scanning or X-ray or sometimes endoscopy will be done. Okay, so these are the two important uh, examinations, diagnosis, purpose, investigations, laryngoscopy, and you have barium swallowing. Okay. What treatment you can advise the patient? This is very So basically, this is a broad problem. You have to check whether any organ involved, like thyroid is involved. You have to treat the thyroid. If the mouth issues are there, you have to treat the mouth. Is there an issue on the tongue? You have to treat the tongue. An issue of larynx, you have to treat the larynx. Pharynx. Okay, esophagus, treat the esophagus. But here, most of the treatment are here you can advise, that is what are the remedies most commonly used in the throat region. You have to know that. That is one is C13. You have to C13 is always best option for throat problem, and as well as P1, and you have P3 also. Sometimes in the electricity you have B, G, and W. Okay, these are the best electricities for all the throat problems. You can try it. If you need to pick up structural, you have to C13 and as well as one extra remedy, you can check C5 also. Sometimes C1. And in the S group, you have S10, okay, and S1 sometimes S2 also. So these are the remedies we can select according to the condition, according to the list. So what are the description you will able to make for patient for throat issues common for every patient you can give the dysphagia, either any problem. Okay. So I particularly advise S1, uh, L1 or anything S1W or sometimes S10 B S1B S10 WE, and you have C that P1 C13 B. Okay. So these are the common prescription you can advise to the patient, which will work mostly issues, digestive issues, structural problem of throat. Okay. Along with if there any infection, you can add Verban also here. Okay, S1 Verban B. Here S10 L1W also. Okay. And another one remedy which is very wonderful, I observe very much. S1 C15 Verban and Y. This is a wonderful combination for not only for digestive system, it will also work on throat issues. Okay. But basic remedy is C13. Along with C13, you can add C13BE or P1 C13B or P3 C13B. C13B is wonderful remedy for all types of throat problems like dysphagia, any uh, ulcer in the throat, anything. Okay. So you can advise the patient, you will get the wonderful results. Okay. So this is the dysphagia about. Yesterday, I miss something about ulcer. Okay, ulcer, mouth ulcer. Okay. So I already told that we have different types of ulcer. We have due to the deficiency, due to the blood issues, or bacterial issues, fungal issues. Yesterday, I forgot to tell you, fungal stomatitis also is there. Okay. Fungal stomatitis. Some patients will get the fungal, like Candida albicans. Okay, this is one fungus which will affect the mouth, which leads to stomatitis. And other than that, we have allergic stomatitis and toxic stomatitis. Yesterday, I forget to tell you this fungal, toxic, and allergic stomatitis. So there are different types of stomatitis. Now, so basically, if the according to the infection, you have to add one, okay, and you have to advise to apply the area also. Here, one thing you have to remember in this failure, if the nerve involvement is there, okay, you need to add F1, okay, and you need to advise the patient for apply application also. C13, F1, if the it is moderate to severe, okay, word to B or W or G sometimes. Okay. So you need to advise for dysphagia, throat issues, because application will improve the nerve involvement as well as structural things which are problematic to the patient. Okay. So this is all about dysphagia. Tomorrow we'll discuss another disease that is very important for this dyspepsia, indigestion issues. Yes. In public class, okay, what are different types of dyspepsia and flatulence. Okay, and we have another issue that is constipation, very common, nausea, vomiting, diarrhea. All these are common diseases nowadays. We will discuss gastritis. These are the common diseases we discuss in class. Today we discuss dysphagia, so kindly note down everything regarding dysphagia. And also we'll discuss gastric carcinoma. Everything we'll learn one by one. If any doubts regarding today's class, kindly ask.